Hello there and welcome to the video. So this is a video on the pharmaceutical companies who charge billions of dollars for cancer drugs that seem to offer very little benefit. Now I've had a bit of a challenge doing this video because there's a lot of information from a lot of sources, and the original source was Scientific American, and they're talking about cancer, how much it costs us, how many people die from it in the US, the UK, around the world. Well, actually, I put that information in. And how much the pharmaceutical companies are making from cancer drugs that really, I'll come to the statistics in a little while, but it seems like they don't do anything. And yet there's billions, if not trillions of dollars being invested in this by taxpayers in the UK and the NHS, and in the USA by the insurance companies and by people themselves. And it's devastating how it's affecting people, not just their health, but financially. We'll come to that in a second. Let's have a look at some statistics first. So cancer is the second most lethal disease in the US, behind only heart disease. More than 1.7 million Americans were diagnosed with cancer, and more than 600,000 people a year die from it. There's 15 million Americans who are survivors of cancer today, 15 million, and almost 4 out of 10 people would be diagnosed in their lifetime. This is according to the National Cancer Institute, but that number's going up, and very soon it'll be about 50% of people will have cancer in their lifetime. But we'll come to the statistics in a minute. So in the UK it's a little bit different, and it's because the NHS is underfunded. The numbers aren't so good. According to the Cancer Research UK, cancer is the leading cause of death, above heart disease and dementia. So it's a little bit different from the USA. And every day around 450 people die from the disease, which is about 164,000 people are dying every year in the UK. So just to give you an idea as to how much a reduction in public healthcare funding affects us, this is the British Medical Journal, and they say that in 2010 there was a reduction in public health spending that led to 120,000 excess deaths just in England alone. So that's quite staggering. A reduction in the amount of money the government were investing into the NHS led to 120,000 excess and, let's say, needless deaths in the UK alone. So this is a graphic from One World Data, and according to research in 2017, there's 2.96 million people are estimated to have died from various forms of cancer in that year alone. 9.6 million people around the world. Now, what's interesting is if you look at the green line, that's the number of deaths that have risen in the last, almost 30 years. So the number of deaths from cancer has risen by 66% in 30 years. Now, you have to take into account that that's including the extra number of people that are in the world. The population has grown. But if you account for the population growth, so you take just 100,000 people, the red line shows that the number of cancer deaths has still risen by 17%. The blue line shows what's called the age standardized cancer death rate. So what the statisticians do is they say, well, the people in the world are getting older as well. And I think it's by about 40 years now, we're actually growing older now. And so what they do is they say, well, because people are growing older, we're going to adjust the numbers for cancer deaths. And that's what the blue line shows. So it's age standardized cancer death rate. How they work that out, I don't know. But if you ask me, that's fudging numbers to make it look good. Because in my opinion, I'd like to hear what you have to say as well in the comments below on this. In my opinion, maybe we shouldn't be dying of cancer even when we grow older. I mean, maybe they're taking a snapshot of something that's already broken and thinking that's normal. So with the age standardized changes for the numbers, cancer's going down. But if you just take a cross section of 100,000 people, cancer's gone up by 17%. So with all of these statistics, why is it then that we always hear in the newspapers and on TV about all these breakthroughs regarding cancer? Game changer, miracle cure, revolutionary, transformative. And here's a few newspaper headline examples just on one quick search, and you can see how much, I would say it's called hype, and you'll see why in a second, there is surrounding cancer treatments. Now, I decided to look into this a bit, and I found a website. It's a US website called Truth in Advertising, and they're a non-profit organisation that looks into deceptive advertising practices. And they said that in a 10-year span, the amount of money spent by US cancer centres reached $173 million, a 320% increase in the amount of money that they spend on trying to get cancer patients to come to their cancer centres. They also found out that 90% of cancer centres were deceptively promoting atypical patient experiences through the use of powerful testimonials. Now, atypical patient experience, an atypical patient is a patient that isn't the norm. So it's a patient that's had, in this case, extremely unusual benefits from their treatment. And they give an example here of Jackie T. She's a CTCA stage 4 lung cancer survivor who wrote in her testimonial for one of these cancer centres, "Yes, it was hard to be away from home in the beginning, but here I am alive 8 years later, so it was well worth it." But it would also have been well worth it for the CTCA to inform consumers that the 5-year survival rate for patients with stage 4 lung cancer is less than 5%. So are the benefits of all the new cancer drugs just hype? Well, according to Our World in Data, without reductions in smoking, there would have been virtually no reduction in overall cancer mortality in either men or women since the early 1990s. No reduction. So what is all this hype about cancer cures and all of the benefits that the pharmaceutical companies are supposed to be bringing us? Well, in an interview with the Guardian newspaper about her new book, The First Cell, Dr. Azra Raza, Professor of Oncology at Columbia University, was asked this question: "Is it fair to say that your book argues that the multi-billion-dollar medical research into cancer is largely wasted?" She goes on to say, "The screening measures that were put in place, like mammographies and colonoscopy, they're the ones that caused the cancer decline by 26%. But she says that those measures were put in place 50 years ago. No one is winning the war on cancer, she says. We're spending $150 billion each year treating cancer, yet a patient with cancer is just as likely to die of it today as they were 50 years ago." And she goes on to say, "I want it to be very clear that using the slash poison burn," now what she's referring to there is surgery, chemotherapy and radiation therapy. She says using those approaches, we're curing 68% of cancers that are diagnosed today. But that 68% we are curing with using Stone Age treatments. So these are some of the costs that are involved. By 2021, the cost of care is predicted to rise to £15.3 billion in the UK. And that's statistics from the NHS. The NHS spends nearly 500 million on cancer drugs developed with public funding. Now, let's explain this in the next paragraph. 3 of the 5 most expensive cancer drugs to the NHS last year were developed from publicly funded research. As a result, the public are paying twice for medicines. First for the research, and then in high purchase prices totaling approximately £500 million for just 3 drugs. And they're listed below there for you to have a look. So what we're doing is we're paying the pharmaceutical company to research those cancer drugs. Then we're paying very, very high prices to buy those drugs from the pharmaceutical company that we've given money to buy the drugs for our cancer patients. It's quite remarkable. And it gets worse as well, because the Cancer Drugs Fund, the CDF, was set up in 2011 to plug gaps in NHS funding for cancer drugs. But get this, according to Cancer Research UK, the CDF has, over its lifetime, cost £1.27 billion. Now that's on top of what the NHS have paid as well for cancer drugs. Professor Richard Sullivan, director at King's College London's Institute of Cancer Policy, says pricing is out of hand. The cost basis of what's happening to medicines is very elastic. The prices just keep going up. It's not about value, but what the market can bear. In the US, it's worse, because there's a lot of private companies involved in research and marketing and selling cancer drugs. The total research spending since Richard Nixon declared a war on cancer in 1971 exceeds $250 billion. $250 billion. That's just like amazing. The cost of cancer care has surged 40% in the last decade to $175 billion in 2020. But get this, this for me is like the worst of all of these statistics. More than 40% of people diagnosed with cancer lose their life savings within 2 years. So you've got two ends of the scale. You've got people in the US using their own money, and no doubt they're using their insurance as well if they've got some kind of medical insurance. But 40% of them are having to use their entire life savings to try and combat cancer. And in the UK, we've got at least an NHS that's paying for our treatment, but because of cutbacks in funding, more and more people are dying from cancer. So let's look worldwide. According to Cancer Research UK, cancer costs the world more money than any other disease at almost $900 billion a year. So you've got to wonder, with all that money that's being invested, what's the return? Okay, it seems, according to the oncology expert we heard earlier, Raza Azra, the techniques haven't changed in 50 years. They're still using the chemotherapy, radiation therapy and surgery, which she says are kind of Stone Age treatments. The other reason cancer's come down so much is that the detection methods have improved. So we're able to detect cancer long before it becomes a killer, basically. So they're able to then use surgery to cut it out, radiation therapy or chemotherapy much more effectively. The other reason cancer rates have dropped is smoking has dropped. We're more aware, at least in the USA and the UK, of the dangers of smoking. It causes cancer, it causes lung cancer, it causes 6 others of the biggest killer diseases in the world. So the cancer industry have been restricted on how they're allowed to advertise, thankfully. But that's not the case across the world, and we'll come to that in a minute. So, for all of the money that's being spent on cancer drugs, let's have a look at what the benefit is. Pharmaceutical companies keep bringing new drugs to market, but one study found that 72 new anti-cancer drugs approved by the FDA between 2004 and 2014 prolonged survival for an average of just 2.1 months. That's shocking. But let's have a look at the statistics regarding smoking. Did you know that the tobacco industry, because they're allowed to advertise still in other countries, I mean, they're still allowed to advertise in the UK and no doubt the USA as well, but they're bringing on 30 million new smokers a year into the deadly habit. 30 million new smokers. And we know that smoking kills. We know it causes cancer and heart disease, yet they're still allowed to sell those life-taking products. Tobacco kills more than 8 million people each year. 1.2 million are the result of non-smokers being exposed to second-hand smoke. 65,000 children die each year from illnesses attributed to second-hand smoke. Of the 1 billion smokers alive today, around 500 million will be killed by tobacco. And if the current trend continues, smoking will kill up to 1 billion people worldwide this century. 1 billion people dying from smoking. That is staggering. A bit of a sad video, a bit of a depressing video in the number of statistics and the amount of people that die, but I hope you enjoyed it. Please like and share it. Take care and see you soon. Bye bye.